I'm Katie, and she gave a nice introduction, so I don't have to repeat myself. And so I will be starting my talk talking about something that touches us all, cancer. So for me, that happened when my grandmother passed away when I was just 7 years old. And that's actually why I wanted to study cancer now. So the type of cancer that I study is called large granular lymphocyte leukemia, and it's a very rare form of blood cancer. Unfortunately, there's very few treatments and no cure. And in comparison to other cancers, it's relatively understudied. But that means each new discovery can have a large impact because the amount that we know is so small. So to explain how this cancer works, we start with a T cell. You can think of them as your body's firemen, and they come out to attack a virus or a fire. They put out that fire, but in the case of this type of cancer, they get lost on the way back to the fire station. They get confused, think they see smoke in the distance, and they call for reinforcements, and they end up in places that they shouldn't be, like your joints. They start spraying water everywhere, and you end up with water damage or inflammation. And so this entire process is really similar to the development of an autoimmune disease, where you have your immune cells attacking parts of your body that they should not be. And what's really interesting about this type of cancer is that it really overlaps with the presence of autoimmune disease. In fact, a lot of patients who have this type of cancer also have rheumatoid arthritis, which is a form of inflammation of the joints. So you have this arthritis, and you have these cancer cells that just won't go away. And one of the things that allows them to stick around are mutations in your DNA, specifically STAT3 mutation. And these mutations are extremely common in this type of cancer. So we know that these mutations are common, and we know that this arthritis is common in this type of cancer. And I want to understand the connection between this cancer and this arthritis. And so I asked the question, are there these STAT3 mutations in rheumatoid arthritis? And to answer that question, I took those fireman T cells and extracted their DNA and looked for those STAT3 mutations. And to do that, I used a super sensitive mutation detection technique called droplet digital PCR technology. You can think of it like a jar of water with a single orange speck that represents a mutation. When you look at that jar, the color looks blue. But if you partition the jar into thousands of little droplets and pour out each of those droplets, eventually you'll get to that one orange droplet. And that allows us to detect very small amounts of mutation in a large amount of background. So I took this technology and I applied it back to arthritis and saw that, yes, there are these mutations in this arthritis. Over half of patients have them. So the next question I wanted to ask is, how does this apply to the cancer I'm interested in? And I know that I already told you that these mutations are in that cancer, but I wanted to know, can this new technology help us detect even more of these mutations? So before applying the technique, we knew that a little less than half of these mutations were present in this cancer. After applying the technique, we saw that a majority of these patients actually have these mutations. So the answer to this question is also yes. So we know these mutations are in this cancer, and we know they're in this arthritis, but why is that important? What are the ramifications? So one thing is, while this cancer is super rare, arthritis is not. So could these arthritis patients with these mutations develop this cancer in the future? And so now that we know all this information, the next question you might be asking yourselves is, how do we use this to help actual patients? So in arthritis, it's really important to treat patients early and effectively to prevent permanent joint damage. And we know in this cancer that people who have these STAT3 mutations are actually more likely to respond to more targeted therapies. So will these arthritis patients with mutations respond better to certain therapies? So my studies have allowed us to ask these new and exciting questions. And it is my hope that by answering these questions, someday in the future, we'll be able to eliminate the inflammation, get rid of those extra cancer cells, and help patients like my grandmother. Thank you.